Theranos, the blood test that wasn't real. In a glass office in Palo Alto, a young woman in a black turtleneck stood in front of investors and told them she was going to change medicine forever. She said a single drop of blood, taken from a finger prick, could run hundreds of tests. No needles, no labs, no waiting. She said it with total confidence, the kind that makes people stop asking questions. Her name was Elizabeth Holmes, and for over a decade, some of the most powerful people in America believed her. The company was called Theranos, and almost none of what she promised was true. This is the story of how an idea that never worked was allowed to reach patients, investors, and pharmacies across the country, and how it finally came apart. Background: Elizabeth Holmes was 19 years old when she dropped out of Stanford University in 2003. She had been studying chemical engineering, and according to those who knew her, she had a fear of needles that she later cited as part of her inspiration. She founded a company first called Real-Time Cures, later renamed Theranos, a blend of the words therapy and diagnosis. Her pitch was simple and powerful. Blood testing at the time required drawing multiple vials from a vein, sending them to a lab, and waiting days for results. Holmes proposed a device that could run comprehensive panels: cholesterol, glucose, cancer markers, infectious disease screening, from a few drops of blood taken with a simple finger prick. She called the device the Edison. The idea attracted enormous attention. Holmes modeled herself publicly after Steve Jobs. She wore black turtlenecks. She adopted an unusually deep speaking voice that former employees and journalists later said was not her natural voice. She surrounded herself with an advisory board that included former U.S. Secretaries of State Henry Kissinger and George Schultz, former Secretary of Defense James Mattis, and former Senate Majority Leader Bill Frist. These were not scientists, they were statesmen, and their presence gave Theranos a credibility that few young companies could match. By 2014, Theranos was valued at $9 billion. Holmes was named the youngest self-made female billionaire in the world by Forbes. She was on the cover of magazines. She gave a TED Talk. She was, by every outward measure, a visionary. But inside the company, the technology did not work the way she said it did. The machine that couldn't do what it promised. From early on, the Edison device struggled with accuracy. Blood samples obtained through finger pricks are smaller and more prone to contamination and cell damage than blood drawn from a vein. Small sample sizes made many test results unreliable. Engineers and scientists inside the company reported inconsistent readings, and some tests simply could not be performed on the device at all. Rather than solve these problems, former employees later testified that Theranos ran the majority of its patient tests, sometimes reported as the vast majority, on modified commercial machines made by companies like Siemens, not on its own Edison technology. The company diluted blood samples to make them work on equipment that was designed for larger volumes, a process that introduced further inaccuracy. Employees raised concerns internally. Several were dismissed or resigned. One of the most consequential voices inside the company was Tyler Schultz, a young engineer and the grandson of board member George Schultz. Tyler began noticing testing irregularities and voiced his concerns to superiors, and eventually to his own grandfather. He was met with resistance from the company and from his own family, who largely sided with Holmes. Tyler ultimately left Theranos and became a confidential source in the investigation that would follow, at significant personal and family cost. Holmes was not operating alone. Her romantic partner and the company's chief operating officer, Ramesh Sunny Balwani, ran daily operations with a management style former employees described as controlling and fear-based. Balwani was nearly 20 years older than Holmes. Their relationship was kept hidden from investors and the board for years. Together, they cultivated an internal culture where dissent was discouraged and where information was kept deliberately siloed between departments so that few employees understood the full picture of what was and was not functioning. Deals with the real world. The most consequential turning point came in 2013 when Theranos struck a partnership with Walgreens. The pharmacy chain agreed to install Theranos wellness centers inside its stores, allowing real customers to walk in and have their blood tested using Theranos technology. This was no longer a company running internal trials. This was a company selling unproven results to the general public for tests people use to make actual medical decisions. Walgreens executives had pushed for independent verification of the technology before agreeing to the rollout. According to later reporting, Theranos resisted full transparency, citing trade secrecy, and Walgreens moved forward with limited direct testing of its own. By 2015, Theranos was operating in over 40 Walgreens locations, primarily in Arizona and California, processing blood tests for real patients whose results could not be reliably trusted. The company also secured a relationship with the Cleveland Clinic and pursued a partnership with the U.S. military to use its devices in the field, though the military relationship never resulted in battlefield deployment. Behind the scenes, Theranos was raising money from a list of investors that read like a directory of American wealth and influence, including media mogul Rupert Murdoch, the Walton family behind Walmart, and venture capital firms that had built reputations on picking winners. Almost none of these investors were shown detailed data proving the technology worked. Holmes controlled information tightly, requiring employees to sign aggressive non-disclosure agreements and instructing that lab operations remain physically separated from other parts of the company, even from most of her own staff. The investigation begins. In 2015, a journalist at the Wall Street Journal named John Carreyrou began looking into Theranos.
After receiving a tip from a pathologist who had grown suspicious of the company's claims, Carreyrou started reaching out to former employees and found a number of them willing to speak, some anonymously, some, like Tyler Schultz, willing to go on record despite enormous personal risk. Theranos responded aggressively. The company's legal team, led by high-profile attorney David Bowies, threatened former employees with lawsuits and sent intimidating letters designed to stop them from talking. Tyler Schultz has since described being surveilled and having private investigators follow him. His own grandfather initially refused to believe him over Holmes. Despite the pressure, Carreyrou published his first report in October 2015. It revealed that Theranos ran the overwhelming majority of its tests on traditional machines, not its own proprietary technology, and that the Edison device produced inconsistent, sometimes dangerously wrong results. The fallout was immediate. Walgreens quietly began halting new blood draw services. The Centers for Medicare and Medicaid Services, the federal agency that regulates clinical laboratories, opened an investigation into the Theranos lab in Newark, California. In 2016, CMS inspectors found deficiencies serious enough to pose what they described as
immediate jeopardy to patient health and safety. Theranos was banned from operating a lab for 2 years, and Holmes herself was barred from owning or operating a medical laboratory for the same period. Real patients had been affected. Some received false positive results for serious conditions like cancer. Others received false negatives that missed real health problems. Physicians reported making treatment decisions based on numbers that had never been reliable in the first place. The collapse. Once the wall of secrecy cracked, it came apart quickly. Major investors and partners severed ties. Walgreens sued Theranos for breach of contract. Forbes revised Elizabeth Holmes' estimated net worth from $450 million to effectively nothing. The company's valuation, once $9 billion, collapsed entirely. In 2018, the Securities and Exchange Commission charged Holmes and Balwani with massive fraud, alleging they had raised more than $700 million from investors through what the SEC called an elaborate, years-long fraud. Holmes settled the civil charges without admitting or denying wrongdoing, paying a fine, surrendering voting control of the company, and agreeing to a 10-year ban from serving as an officer or director of a public company. But the criminal case was still ahead. Later that same year, federal prosecutors indicted both Holmes and Balwani on charges of wire fraud and conspiracy to commit wire fraud, related both to investors and to patients who had relied on faulty test results. Theranos dissolved as a company shortly after. The trial. Elizabeth Holmes's criminal trial began in September 2021 in San Jose, California. Balwani was tried separately. Over the course of the trial, jurors heard from former employees, investors, and patients. One witness described receiving a Theranos test result suggesting a miscarriage that had not actually occurred. Others described chaotic lab conditions and results that shifted dramatically between tests taken minutes apart. Holmes's defense argued that she had believed in the technology, that failure was not the same as fraud, and that she had been manipulated and controlled by Balwani during their relationship, including allegations of psychological and sexual abuse, which Balwani has denied. Holmes herself took the stand, a rare move in a case of this scale, and testified for 7 days. In January 2022, the jury found Elizabeth Holmes guilty on 4 counts of defrauding investors. She was acquitted on charges related to defrauding patients directly, and the jury deadlocked on 3 additional charges. In November 2022, she was sentenced to just over 11 years in federal prison. Ramesh Balwani was convicted on all 12 counts against him in his separate trial and received a longer sentence. Holmes gave birth to 2 children in the years between her conviction and the start of her prison sentence, and after a series of appeals, she began serving her sentence in 2023. Ending. Theranos never delivered a single test that lived up to what Elizabeth Holmes promised on stage. The Edison device that was supposed to revolutionize medicine could not reliably do what a standard blood draw had done for decades. What it did do was raise nearly $1 billion, place unreliable results in front of real patients making real medical decisions, and expose how easily confidence can be mistaken for competence when enough powerful people choose to look away. The people who tried to raise concerns early, engineers, employees, a grandson willing to go against his own family, paid a personal cost long before the public understood what was happening inside that building in Palo Alto. It took a journalist willing to keep asking questions and sources willing to risk everything to answer them before the truth caught up with the story Elizabeth Holmes had been telling the world. She is currently serving her sentence in a federal prison in Texas. The company she built is gone. The device that was supposed to change medicine forever never worked at all.